Thank you, Gina, and thanks for the invitation to be part of the coronavirus conversations. So I will just run through very quickly a few key findings from some empirical research that we at the Reuters Institute for the Study of Journalism have been doing, some of it in collaboration with the Oxford Internet Institute, some of it supported by the Oxford Martin School and other by the Nuffield Foundation, that I think capture some key aspects of what I think of as the communications crisis that accompanies the coronavirus pandemic. So I think the way to think about the communications crisis aspect of this is that when facing an epidemic, we have a medical emergency, but of course also a much wider societal, economic, and political crisis. And a key part of how individuals in the public, but also society at large, responds to a crisis like that is whether they in fact have and feel they have access to trustworthy, credible, and relevant information that tells them how they can protect themselves, how they can protect their loved ones, and how they can help their communities navigate this crisis. And the World Health Organization has highlighted from the beginning of the coronavirus crisis that it was accompanied by what they describe as an infodemic, a situation where we have an explosion, what they call a tsunami of information, including some of it misinformation and rumors of various sorts that will influence how people see the situation, and as a consequence also how they respond to it and how they judge and comply with or not the guidelines offered by health authorities and governments. So we have tried to study this crisis in real time to help news media, to help civil society organizations, health authorities, governments, technology companies, and others, and citizens themselves to understand the communications crisis, even as they also try to navigate the medical crisis. So 3 things to highlight from that research. The first one is, as the World Health Organization has highlighted, there has been a massive growth of COVID misinformation. And Christina Tagliere, the Associate Director of the International Fact-Checking Network, has called this the biggest challenge that fact-checkers have ever faced. Much of this spreads via various social media platforms, via various video sharing sites, and via various messaging applications. Some of it comes from the top, and others of it is sort of peer-to-peer sharing amongst individual citizens. I think there are sort of 3 things to sort of highlight about the massive growth in COVID misinformation from the research we've done with the Oxford Internet Institute with support from the Oxford Martin School. The first of it is that most of the misinformation that fact checkers have identified and fact checked is not fabricated. It's not false information. It's certainly not deep fakes. These are reconfigured pieces of information where people, sometimes in good faith, sometimes with ambiguous motives, and sometimes maliciously, take factual, accurate information, repackage it, and represent it in ways that are fundamentally misleading. So much of this is not about being false, but about being misleading and often based on information that in itself, have been true. For example, a photo taken in one situation and then repurposed for another situation. The second thing about misinformation is that social media engagement specifically with the misinformation is often driven by prominent public figures. This can be high-level elected officials, in some cases presidents, who are spreading false or misleading stories or narratives about the crisis. In some cases, it's celebrities who amplify or originate false and misleading stories about the disease and responses to it. And in some cases, we've seen high-profile businessmen also spread this. And while, of course, such individuals are a small part of the wider public conversation around this, including on social media, because they have very large followings and often followings that amplify their messaging, we see that they account for a very large share of the social media engagement with misinformation. And finally, we should also say that, of course, many different social media companies often have policies against information that might cause direct harm, including misinformation around health issues like the coronavirus crisis. And when we've looked more closely at cases of posts that have been identified as false by independent professional fact checkers, we find that the social media companies on balance seem to have responded to a majority of these posts, but far from all of them. And that there are some meaningful differences with a company like Twitter responding to a smaller set of the posts that are identified as false by fact checkers. And platforms like Facebook and YouTube have been more aggressive, though, of course, we have, I think, in recent days seen some pretty prominent exceptions to that general pattern. The second thing I want to highlight is that in addition to the massive growth in COVID misinformation, we also see some very pronounced social inequalities in COVID-19 news and media use. Three things just to draw out here. One is that we find in the countries where we've done survey research that people with lower levels of formal education often know less about coronavirus. They rely less on news media and often trust news media less. So we have a sort of a classic social inequality around education here as a proxy for class. We also have some very pronounced age differences where younger people in many countries rely less on news organizations for news and information about coronavirus and often also trust them less. Here, perhaps more encouragingly, we also see young people search out for information from other sources, often via platforms, sometimes from scientists and experts, sometimes from governments, sometimes from their friends. And we find no consistent pattern suggesting that young people are less informed about the disease than other people in the population. Finally, we see in particular as COVID news fatigue sets in, at least in the UK, where we've done work on this supported by the Nuffield Foundation, that women are more likely to say that they are actively avoiding news about COVID than men are. And we would suggest that this is compounding existing gender inequalities in news use, probably at least in part due to unequally distributed caring responsibilities, where again, also in this crisis, of course, women are impacted in different ways from men as countries go into lockdown and as families have new challenges to handle at home. The third area that I just wanted to quickly run through from our research before we open up for the discussion and later the questions is the question of the role of government in this. So this is research specifically from the UK, where we've been tracking this since the middle of April. And now 6 weeks later, with 4 waves of the survey, we can find that while initially when we started the research, the UK government was very broadly trusted and very highly trusted as a source of news and information about coronavirus. 67% of the UK public said that they trusted the government as a source of information. This has changed very dramatically in just 6 weeks. So this is the biggest change I've seen in research of this type for the 10 years that I've been doing that kind of work. 19 percentage point drop. By now, it's no longer a majority of the UK public who say that they trust the UK government as a source of news and information about the coronavirus. In parallel with that, we've seen, I think, equally worryingly, that there has been a big growth in the percentage of people in the UK who say that they are concerned about the government being a source of false or even misleading information about coronavirus. When we started the survey work in mid-April, we had just 27% saying they were worried about this. By now, it's almost 40% of the UK public who say that they are worried about the UK government being a source of false or misleading information about the coronavirus. And I think this illustrates how a situation that initially produced a little bit of sort of rally around the flag situation, where people sort of came together around establishment institutions, have quickly become recognized for also being a profoundly political crisis and a situation that is dealt with in very different ways by different governments, very different consequences for different parts of the community. And people who initially perhaps were willing to give governments and other powerful institutions the benefit of the doubt, by now are beginning to worry that they cannot perhaps trust the government, or that the government, even in some cases, may be in fact misleading them about the crisis. So I think this suggests that we are facing a very serious communication crisis to accompany the medical crisis and the pandemic. And this will be critical for the public health response because, of course, even though the medical response and the public health response is at the center of how we deal with the pandemic, if people don't understand what's being done and if they don't trust the guidelines and the suggestions made by government and health authorities, it's less likely that they will be able to protect themselves, their loved ones, and their communities, and it's much less likely that they will comply with or feel that government guidelines and the like are legitimate and ought to be complied with. So in that sense, I think there is a powerful communications dimension to this crisis, and one I look forward to discussing with Gina and later with the questions that come in. So thank you very much for this opportunity to present a few highlights.
Thank you, Rasmus. Just a reminder, you can send your questions in for us via the YouTube chat function or via Twitter. And I just see from the people helping us out on this chat, helping us produce this conversation, that there are questions coming in through Facebook as well. You can also email us at covid.conversations@admin.ox.ac.uk. That's covid.conversations@admin.ox.ac.uk. So Rasmus, this research that you're able to capture in this moment of what is a crisis in information and a crisis in public health really brings, I think, a perspective on information and misinformation that we haven't necessarily been thinking about. Much of the conversation around misinformation has been about the spread of deliberate and false and really affective or, posts to make people riled up or angry. And what you brought out here is that this isn't necessarily false information, that there are certain dynamics of social media platforms that are at play here, that these are often misinformation is often spread by very powerful people with a lot of followers, and that it helps amplify these messages. And then it's really hard to respond when there is a kind of some element of truth in some of the information and misinformation that's being spread. So what are the answers to this crisis, this information crisis that we find ourselves in? I know there's no short-term or easy fixes, but where should we start?
I mean, I think we should start by taking some encouragement from some of the findings in the research that I talked about, which includes, for example, that we find quite consistently across the countries where we've done surveys that people who rely on information from independent news media are consistently associated with knowing significantly more about the disease than people who don't. So in countries where there are independent news media with professional journalists, there are sources of information that are not perfect. They will make mistakes as well. They will get some things wrong. They will sometimes amplify various sort of outrageous narratives from politicians or others. But on balance, that can help people really understand the crisis and then make up their own minds about how they want to respond and what they think of, for example, of how the government in a country is handling the situation. So I think there are things that can be done. We're also seeing fact checkers doing an incredibly important work, both in sort of signaling to powerful people that they're onto them and that it's not sort of without a public record if people lie or mislead about this thing, but also can help both individual citizens but also platform companies make decisions about what information they can rely on. Now, that doesn't mean that there isn't room for improvement. There's a lot of room for improvement. We've had some very serious misinformation problems we've focused on a lot since 2016 in particular, information operations by hostile states, as well as for-profit misinformation that often is enabled and monetized through the algorithms and ad systems of large platform companies. These are important ones. We need to continue to focus on those and deal with them. But I think here we see a darker gray zone, if you will, some of which is about individual citizens, sometimes in good faith, sometimes in ambiguous ways, and sometimes in a more sort of malicious way, spreading information that isn't necessarily sort of strictly false, but is potentially misleading and thus potentially harmful in a crisis like this. And that's quite a hard situation to respond to from the point of view of news media, the public, or platform companies. And similarly, of course, with politicians, where sometimes they will be caught out making statements that are blatantly untrue and can be sort of fact checked as such. But much of what the more problematic political discourse around this is not really demonstrably untrue. It is misleading and thus operates in a gray zone, where often private companies feel it's not really their role to directly challenge powerful people who live in public life on the veracity or good intent of their statements, which are, of course, rules we've long had for example, the privilege of parliamentary speech, or for that matter, the exemption of political advertising from standards of accuracy in the advertising standards authorities here in the UK. What can be done then? Well, I mean, I suppose I believe in the power of independent professional journalism. That's one important part of the response. I believe in fact checkers. I think the platform companies have a lot of work to do in this space about clarity about what exactly their rules for content moderation are, consistency in enforcement of those rules, also when any breaches are committed by powerful people, and then greater transparency and data sharing so that independent researchers, civil society organizations, news media, and individual citizens can better understand what actually happens in these environments. On the government side, of course, well, let's just say the sort of factual accuracy and trustworthiness would be a good start. And that while it's important that political decisions are informed by science, I think it would behoove politicians to not sort of try to hide behind the science and to recognize that any crisis like this also involves political choices, and that they should sort of stand by the political nature of the choices that they are elected to make.
You know, we've seen in this particular crisis in several countries that we've thrown out the crisis communication handbook, right? We know some things work in communicating public health crises. Governments have been prepared with knowing how to do information management, and yet we've seen how being able to admit that someone doesn't know information, or being able to admit that someone was wrong in something they said last week, goes a long way in building public trust in ongoing information. There have been many good examples of leaders who have been able to establish and develop that kind of rapport that becomes an important resource for having to deal with this crisis at this moment. Do you see a relationship between the challenges of public communication, crisis communication, and what's happening in misinformation?
I mean, that there is no question that the sort of digital media environment has compounded many of the challenges, and that there are also new challenges that are distinct to the digital media environment, and that some of these have to do with sort of the way in which for-profit companies have built very large and complex systems that we have only later really begun to understand the social implications of, and start to think about what the negative externalities that may accompany these systems, in addition to the benefits that they bring, might be, and how we can respond as societies, in addition to how the companies in question could deal with this. I think, I suppose, more fundamentally that I think a sort of a possible limitation of some crisis communication sort of guidelines is that they don't always recognize that these situations are often profoundly political, and people will disagree about how to respond to them for very different reasons. And it can be quite hard to simply have sort of a straight an instrumental response to this in a situation where people will fundamentally disagree from very different point of view, different values, and also fundamentally face very different consequences of their actions. And I'm not sure that sort of more professional guidelines for communication can solve what I think is fundamentally a political problem.
Mm-hmm. Yeah, I think that's interesting, and I think that does dovetail quite well with the research that you presented around the lack of trust, the falling trust, the rapidly declining trust in public trust in government and politicians. That we're seeing a tension between that this really is an infodemic, not necessarily because of misinformation, but because of these kinds of ways that people are either avoiding news, or, as you've called it, COVID news fatigue. Related to that, I'd like to turn to our first question. A listener on YouTube asks, scientists have lost credibility to the public because some scientists wrongly released information but based on poor quality studies. Do you know how this will affect scientists' credibility?
I mean, I think that's a real challenge. There are examples of work that has been rushed out and that hasn't sort of met the standards we would associate with sort of best practice. I think we've also seen, quite worryingly, some examples of things that are released in the form of press releases with no access to the underlying research, which I think is quite troubling, and really against the sort of the scientific ethos, if you will, and the idea of publicly making your work available so that colleagues and others, interested parties, can have a closer look and judge on their own terms whether they think that this is robust and convincing. And also, frankly, I think we need to recognize that sometimes, sadly, university PR can sort of compound this problem. That said, while science clearly is imperfect, and in a crisis like this, perhaps some of those imperfections are brought into the light, I would also say that science is perhaps less imperfect than many of the other institutions who offer interpretations of the crisis, and less self-interested, if you will, or at least self-interested in a different way. So far, while the problems that the viewer on YouTube highlights are real, I think, in our research, we have not found evidence that it has had consequences for people's judgment of how trustworthy scientists are. Unlike the very marked decline in trust in the government that we document in our research, we've seen no similar decline in trust in scientists and experts, at least in the UK.
That's really interesting, because it in part suggests that it's not simply the fact that we don't have definitive answers. It's a trust in knowing that someone is being honest or upfront about saying they don't know a definitive answer, right? That tension, as you alluded to earlier, between this being a political crisis as much, or these being political decisions as much as they are scientific, rather than hide behind the science, kind of making the stakes clear, can actually lead to perhaps not decline in trust. We have a question on gender bias, and I think it comes in part back from your information about the differences between men and women on news. Are there gender biases in information reinforced or broken down in this particular crisis?
So we have long found, like other researchers working in similar areas, that there are marked gender differences in news use. I think, sort of simplifying and exaggerating slightly, you can say that in many countries it's still the case that news is largely produced by white, affluent, educated men for white, affluent, educated men, and is often about white, affluent, educated men. And that, unsurprisingly, we thus also find that, for example, women often follow sort of mainstream established news sources a little bit less closely than many men do, perhaps in part because they don't find themselves and people like themselves reflected to the same extent as white, affluent, educated men often do. So there are pre-existing gender inequalities in this. Benjamin Tough and Ruth Palmer have shown that news avoidance is already in part relied to inequalities of caring responsibilities in the home. And we don't have direct evidence to suggest that that can help account for the gender differences in how actively people in the UK avoid news around coronavirus. But it seems to me it's a very plausible explanation when we have much higher levels of active news avoidance amongst women in the UK than amongst men, is that in many households, women are juggling a wider range of complex responsibilities and a lot of unpaid labor. That will, of course, impact their ability and willingness to also take on the emotional, intellectual work of consuming news that they may find sort of doesn't quite connect with their own lived experience and is reported on other people's terms. So I think it's an interpretation, if you will, and it's something we will look at more closely in the months to come.
These stories that we tell about the impact of coronavirus and COVID-19, I think, are incredibly important, especially because this crisis is far from over. And as we see countries in Europe and the United States easing lockdown, I think we need to really get these stories right. This, for example, in this country, the report on the differential impact of COVID-19 on British Asian, Black Asian, and minority ethnic people in this country has been held. It was supposed to be released this week. It's not being released yet. We know that there are enormous differences in race and gender that are happening in the impact of the crisis. And yet we know, as you said, that we have an increasing production of the stories that we're telling are stories about, people like us from the point of view of newsmakers. And so I think we have to be really careful in terms of using this as an opportunity to amplify and recognize the stories that are out there, the people that are suffering.
I wonder, Gina, whether it'd be worth you also just expanding on the observation you made yourself earlier on, and how in the United States, for example, the news coverage often tended to focus on sort of particular types of community transmission centered on, say, cruises or conference events, while the underlying data suggested that there were sort of a very different pattern that really actually drove community transmission in the US, and the role you think the stories might play in helping people better understand what the crisis is actually like.
Absolutely. It's, one thing to center on the fears of professional white elites who are worried about their conference going, their holiday, their business meetings, taking flights. And yet, when we look at the numbers in the UK and the US of where super spreader events are and who is most impacted in this first wave of coronavirus, it has overwhelmingly been in workplaces and in low wage workplaces. And that's true in this country and in the US. And so the stories we've been telling have been about elites, birthday parties, jet setters, people doing these things that seem risky, when in actuality, showing up to work is one of the most dangerous things in coronavirus right now. For many of us, we've been fortunate enough to work for organizations that have allowed us to work from home. We have jobs that keep us safe at this particular moment. But for many people, this risk is still very real. And I think we need to get better stories about who is being affected and how. We have a question we have a question about the power of platforms. So given the impact of Twitter's policies, and I would say social media platforms in general, it is the fact that views are being silenced, is that based on a political ideology?
I mean, this is a very live discussion, obviously, and very public discussion increasingly. I would also really love to hear, Gina, from you, your thoughts on this issue. I mean, you've written very incisively about sort of tech solutionism and the idea that there are sort of technical solutions to many of the issues that afflict us in public life today. I suppose that we've known for a long time in media research that people often think that the media are against them. This is called the hostile media effect. I think we can sort of see quite clearly that this is sort of replicated in lots of people's interpretation of both misinformation problems. It's not me who's the problem, it's other people. Or in how platforms and others engage in content moderation. You know, how could you possibly let these people get away with this when you try to sort of restrict the reach of something that I have written? So far, I have not seen a single example of rigorous evidence-based research that substantiates the idea that there is any partisan political bias in how content moderation is practiced by any of the major platform companies. I think we should continue to examine this. It's a really important topic. These are very powerful institutions. They should be scrutinized very carefully and very closely, independently. But we should also, I think, not lend credence to self-interested political discourses that sort of claim victimhood, often from very powerful people who sort of try to convince other people that they are the victims of conspiracies, when in fact we so far have no evidence at all to suggest that. And we might even suggest that sometimes these powerful people are given special treatment.
That is a great point. That we've had a conversation about the role of platforms as being political, but we haven't really unpacked the idea that people from different race, class, and gender positions approach these platforms in very different ways, and they navigate them in very different ways. That literally the same platform can afford very different action depending on a person's social position. So, we have this, someone who is quite powerful will bring that power to the platform. Is it any wonder that someone who is has the largest media platform in the Western world could approach Twitter and Facebook in very different ways than perhaps someone who is a protester on the street today?
Indeed. Power does not go away just because we develop new technologies, nor does social inequality.
Rasmus, on that, I think that's a perfect note to end on. I want to thank everyone who joined us today. We are at the end of our half hour. I want to encourage you to join next week, the same time, for the next COVID conversation. And that will be on the UK's contact tracing app, which is another hot topic that the university researchers find themselves in the center of. And again, thank you to all of you. Thank you, Rasmus, for a great conversation. And thank you all for joining us.
Thank you, Gina, for hosting.